Hi there, I'm Ingrid Brindle and I'm Chair of Horton Thornley Patient Participation Group and also the local cluster group. And I'm sorry I can't be there. This seems a bit funny, like the Oscars or something. Sorry I can't be there, but anyway, hope you have a good meeting. And I just wanted to talk to you about our atrial fibrillation detection project. So I thought it'd be helpful to have some key facts about atrial fibrillation. So it's a heart arrhythmia that involves the top two chambers of the heart, the atria, and the irregular beating of the atria means that the blood doesn't flow through the heart properly, and so it can clot. And if there's a clot, it can go straight to the brain and cause a stroke. Around 30% of all strokes are AF related, and 1 in 4 people with atrial fibrillation are undiagnosed. So if we could improve the detection of AF and save just 3 strokes in the practice, that would save around £250,000 in on costs. But much more importantly, it would save the devastating effect of a stroke on both the victims and their families. So improvement in detection of AF is a really big deal. When we were awarded the prize for being the most outstanding PPG in the UK, we got some money, which we decided to use to buy some AliveCore devices. And this is an AliveCore device, which is a fantastic piece of kit, which can be linked to a mobile phone app or a tablet and used to produce an ECG. That can then be emailed to a doctor. What we want to do is we want to loan them to patients who are having episodes of AF, which then just go away. That's the trouble with an episode. It can happen at any time of the day or night. It's especially distressing in the middle of the night, as I know to my cost. Horrible. But once the episode's stopped, it doesn't show up on any subsequent ECGs or heart monitors. So it can take a long time and lots of money to diagnose. So if people have them there when they have an episode, they can do it straight away. We're also going to screen other patients at flu clinics and things like that who may have low-level asymptomatic AF, which is just as dangerous, and we can pick them up then. We've been working very closely with some great people in the Hyde and Hollingworth area, and we've done all the procedures, protocols and pathways. Special thanks to Jane Harvey, and we're ready to go in Hyde and Hollingworth. Then we hope it will be possible to roll it out across the other Tameside practices, and we're just waiting for the devices, and we can't wait to get going. And I just wanted to talk about one of the aims of our patient group, which is to try and improve the health of our patients and the health of our local community. And one of the ways that we try to do that is by holding our self-care open days. And we hold these in the shopping centre in Hyde, or also on Hyde Market, which is very successful. We also do some sessions in Morrison's Supermarket in Hyde. We're very, very lucky that we've been able to work closely over the years with Manchester Metropolitan University Department of Nursing through Jackie Gladwin, who's one of our patients, and they go into Morrison's Supermarket every year for a whole week, doing health checks and giving advice and things, and it's so popular there that they've now got regular customers who come up and say, "Oh, ready for another." So we're very keen on spreading that sort of information. We've just held actually our 8th open day on Hyde Market, where we talked to over 500 shoppers, which is a tremendous amount. And this time we were joined by local cluster group patient participation groups, and also supported by our practice here and Dr. Hannon and other people. So some of the things that we did, we gave out my medication passports, which are a fantastic piece of kit to remind people about their medications. Also a good icebreaker. you know, would you like one of these? They're free. You might be interested. That sort of thing. We had public health and Be Well Tameside there doing health checks and also signposting to Be Well services and other appropriate services, which was great. Carol Hill came from the bowel cancer screening project, and she said she had a fantastic day, signed up loads of people, and also said it was a great opportunity to talk to people who had previously been afraid of bowel cancer screening and not sure what to do. So she said she made a lot of progress there, so that's great. We demonstrated the Sugar Smart and Food Smart apps with lots of different foods, and parents and kids were absolutely staggered at what's, you know, lurking in the food that we buy sometimes. And I think it's a great idea to be able to get kids involved in screening what they eat, and then they're more likely to get engaged, aren't they? We talked to people about atrial fibrillation and gave out some Know Your Pulse cards and information on how to do your pulse. We publicised activities in the area, Grafton House, Hattersley Hub, and also a fantastic project in Duckerfield at the moment called The Shed, where they're working with men who aren't usually easy to engage in other activities and can get isolated, so that's great. We offered dementia awareness information. We signposted people for advice on all sorts of other issues and local contacts for information. We shared information on how to get online access to your GP records and gave out forms. We tried to get people interested in being on a PPG or forming a PPG, but we don't think that went very well really. It wasn't terrifically successful, that bit. We gave out some great healthy eating recipes, etc. I think that's most of what we did. I know last year we had somebody who was giving out diabetes advice, and I hope we do that again next time. But it's a busy day, and we were all absolutely shattered, but pleased with what happened. Our next one is planned for Self-Care Week in November. So onwards and upwards. Just a little thing that's a bit of a beef of mine about social prescribing. I know the King's Fund and other agencies always describe social prescribing as enabling GPs and nurses and other primary care professionals to refer people to a range of local non-clinical services. And it's always described in that way, and I don't think medics are the only ones who can do that, because I think that's what we do. Anyway, thanks for listening. Bye.